how we can fix it. Can you do it 100%? No, but pretty much close to 99% or so. And you know, you do the interest and show the interest and the patient's well-being and in helping them, and the results are you know, guaranteed for the most part. The only thing we should know, everything's in God's hand. He's the only curer. And the means that you have to go with what we've got. But you know, if you follow these rules, these are golden rules that work just about every time. So keep everybody healthy and away from the hospitals and the huge cost involved. We're talking about maybe 30 to 40 times of what you do outpatient. And ER visit, you know, this is, you know, maybe one ER visit equal to a year subscription of this, or any one stress test in a hospital. And this is real, you know, equal to 3-year subscription of this, you know, health maintenance. So if for a very, very tiny small fraction investment of what it is out there that's given out and bleeding out and you're not getting nothing, maybe we can start to give people hope and have, especially for the self-pay and for this category, if they want to have what we call a hybrid approach, where we have a small amount for the maintenance and then the rest will be either what doc would happen if I have to go, like a motor vehicle accident or something, I have to go to hospital, maybe the catastrophic, you know, insurance, and then 50 to 60% of the difference will be kept in your pocket. So that will help to decrease the stress, help you know, maybe go out on vacation with the family and enjoy this extra saved money without compromising your, you know, your health and both mentally and physically. Let me give you the service. And this will go over in the agreement between, you know, whoever wants to be part of this program, again, from 30 to 65 for self-pay, or those who have insurance but they're not happy or not satisfied or want to have to explore other things. There is a lot of people in the Chamber of Commerce. I know it's the middle of the week, but there's a lot of people that actually showed interest and expressed interest that they're going to be part of this, because that is the magical answer that they have been waiting for to actually help them. So clinic visits, up to 2 visits a month. You know, 1 visit, you know, like I said, in ER somewhere, it'll be 1-year subscription. And I'll tell you, and I have all the numbers. This has been in the works for about 4 years. And I could believe this could be a local and a global model to affordable health care that through prevention and wellness can really turn things around. What it would do is all cardiovascular testing that we offer in Brooksville Cardiology. Treadmill stress test. And in some instances, we'll do the stress test, not the treadmill running. And if someone cannot run and they have maybe coronary disease, we do this sometime with the injection and nuclear stress test, which is costly, but you know, it's in the same package or the pool of individuals that's going to subscribe to the, you know, so it kind of blends in. Arterial Doppler, somebody complaining of bad circulation in the lower extremities because when they walk, they get cramps on the legs. It's called peripheral arterial disease. So we can check this out non-invasively. Carotid Doppler, if somebody have blockages in their carotid arteries that could be leading to strokes, we can identify that early and address that early. Pacemaker Check. Today we had a pacemaker clinic, and this is very important for the defibrillator. It's like almost every 3 months, and it is costly. Pacemaker every 6 months, and it is costly. And so all this is all included in that package. The Venous Doppler, if somebody have pain in the legs, and they may have a lot of varicose veins that can cause them, or they have a family history of blood clots in the legs from the parents or family, they have this tendency. So we can check the legs to make sure that there's no blood clots in there. Someone who come in with a complaint of palpitations or regular heart rhythm, and we can put a Holter monitor on them and wear it for 24 hours. That's also included in the package. In EKG, you know, that if you go anywhere, just get an EKG. That could be the whole monthly, you know, fee just for that visit. But we'll do it at baseline. Anybody who walks in have to have like an ID. That's your ID for the heart. an EKG. That tells you exactly what your heart looks like. And eventually, as the technology goes, maybe you will have this, like a flash drive for each one with all the information on it, or medical information on it. So anywhere you go, travel, whatever, if I'm standing now and then I passed out, somebody will be able to get my data, plug it in, and it will be my medical ID. So all these things, and I'll talk to you about how we can use the technology to really help out. All-year supply of black seed. What did you say, Doc? Black seed. Anybody heard of black seed? Okay. I'm not making any testimonials, and I'm not, going to, push any words in anybody's mouth. But for personal experience, and this has started actually with my wife, who told me about it in one of the conferences in Orlando. We were there and said, it's right there. And since that day, it changed my life. My kids had problem with asthma and allergies and so on and so forth. It helped us, and it helped, tremendously to able to get up and go to work and handle this huge amount of stresses and challenges of running daily practice and business and taking care of the family. So black seed, magical black seed, was found in King Tut's tomb 7,000 years ago. And it has about 250 active ingredients that absolutely will turn around your immune system and reset it to be brand new. If you have cancer cells, and this is, Patrick Swayze, Dirty Dancing, pancreatic cancer, it'll be the treatment of choice for people who have cancer. It can tell which cells are diseased and which cells are healthy. Now, the current therapy for chemotherapy, it kills everything. So people lose their hair, the bone marrow becomes depressed, and they just become devastated. Now, the smart thing about black seed, it can go and modulate the immune system, so it will stop the replication of the cancer cells. What do you mean, Doc? It'll starve the cancer cells. When you starve the cancer cells, what's going to happen? It'll stop replicating, and bingo, you have remission. Again, if you don't believe me, Google black seed, anybody, and we have some information out there that we can pass along to everybody so that they know what the black seed is about. Black seed also helps, in connective tissue disease, immune system, it helps depression, it helps with anxiety, it helps with milder degree cholesterol and triglycerides, it helps with any non-healing ulcer, by this very, very, very potent mechanism. And we have it in Brooksville Cardiology, and we're going to give the patients a whole year supply in that package, a whole year supply of black seed. There is, it works for everything except that. That's what, 1,500 years ago, the Prophet of Islam, Muhammad, peace be upon him, he said, in this black seed, and it's verified, and it works well. And we have tons of testimonials that will testify to that fact. I have an 85-year-old lady who kept losing her hair. And one day she came out in the business mix and said, Doc, I got my hair back. When she started using, the black seed. So this stuff is really awesome. With daily stresses, you need that inner strength, if you would, to be able to handle all this, non-stop stresses that come in your way without crashing. Make you strong enough to handle that. We have also the flu shot, annual flu shot. It's also included in that, agreement, in that deal. And the most important thing, we'll just try to bring things back in a simple way. I'm a patient, I want to see my doctor. You come, you be served. And no hassle with co-payments, no hassle with pre-authorization, no hassle the girl staying on the phone and, we're not going to get authorizations. And we have a lot of people, okay? Your, gatekeeper, primary care is not going to give us, what do you mean? Patient's going to come. We need to check the defibrillator. We need to check on this patient's heart. He has a heart failure, this and that. And patient's not going to get authorization. If you don't like it, just, call the insurance company and complain. And if anybody, have, experience with that, you're not going nowhere. And similarly, if you don't get denied the payment, even after delivering the service, so the whole thing is just, not getting anywhere. It's a lost energy. It's something that we'll need to give people hope by giving alternative. America is about a choice. You know, I want to have Spanish food, right? Okay, with a little jalapeno tonight, everybody, you know. I want to have Mexican, I want to have Chinese. So America is about choice. And similarly, in the healthcare, we want to give people a choice in the free market. And let people choose inside where they're going to go. If they feel comfortable, that's the place for them. We have a promise for anyone who walks through the door, Brooksville Cardiology, that they're going to get justice, the medical justice, whatever they need. And we serve all mankind's, all across the board. So it's not about money. That's not the issue. The issue is we're able to continue to provide the service and also continue to pay the bills and you know, give the staff payroll and so on and so forth. So this is very, very important. No one is going to deny. We don't have to go for begging, you know, and spend half an hour and then comes back, the referral denied, the patient in the office. And we have a patient like went in tears, and we have to deal with all this nonsense. You know, it's really happening, folks, and it's really, you know, let's not pretend that this stuff doesn't exist. It's real. And we're not going to be denied for a pre-existing condition. You know, I have a patient, you know, he's like 56 years old. I'm going to give you a real life example. 56-year-old guy, he just, you know, 70 million Americans have high blood pressure. So he just came and we did a stress test. Everything's fine, stress test normal and so on. So he went to one of the big companies and wanted to renew his insurance. They denied him. So he came, doc, you know, they said I have hypertension and I'm denied. So what do you need insurance for if you're going to be denied even for hypertension? What do you need? What do you need for a healthy guy? Well, we keep, you know, and I'm going to give you a lot of examples. This is from my own family, my own daughter. She was 6 years old. She went for 6 hours outpatient. Just take her tonsils out because it used to be, you know, like inflamed and stuff. And they said they had to take the tonsils out. The bill was $25,000. 6 hours outpatient, and the insurance, they deny it. Now, I'm a physician, right? And they said it's pre-existing condition. And you got to fight and write reports and tell them, hey, I'm a physician, don't mess with me. You know, and then, you know, another one said, you're going, sir, you're going for a collection. What is it? I'm telling you real stuff, folks. You know, my daughter tripped on, you know, on playing a game and had to get an x-ray, and the insurance didn't pay. You know, I paid the insurance. Actually, they take the payment out of my account electronically. I mean, I have no choice. You know, they get their money in and so on, but I'm not getting what I'm supposed to be getting. You know, even for x-ray, they're going to send me for collection. And then like, what is going on here? What I'm trying to say to you folks, this is different. This is like different, you know, environment altogether. And to get people out of this madness and offer them hope, and offer them a whole new style based on kindness, based on the old-fashioned values. You're a patient. This is my responsibility to do the best for you and to help you to go up and then get on your feet and then, you know, go and take care of your business and your life and so on, and enjoy life to the fullest, regardless of anything else, whether it's, I mean, pre-existing for what? This is artificial stuff. Suppose I have a bad knee or a bad hip. Why should I be excluded for, you know, I need help. What medical insurance is for then? What is the doctor there for then if everybody's going to be denied? You know, the sick that need help, they get denied. The healthy one, you know, they get the insurance that's very, you know, extreme, and it's kind of really sad. And I remember, you know, in New York City when I was, you know, doing an emergency room physician, you know, 15, 16 years ago, I did ER, I did emergency care, I did trauma, you know, and then somebody comes in, you look into that, okay, guys, good insurance. What do you have? Abdominal pain. My belly hurts. Okay, you get the CAT scan, the whole works, buddy. You get somebody the same complaint. I have abdominal pain, no insurance. Okay, what do you got? A UA, a urine analysis, $7. And then you get the cocktail, you know, everybody knows, you know, little Mylanta, you know, and then out the door. Gus is laughing because you've seen this, right?